everybody, and welcome to Safe Geriatrics. On this channel, we're going to guide you through taking care of your elderly ones, your parents, your relatives, or anyone you know who is elderly. In a world that is so busy, we find it challenging to take care of our elderly ones. Sometimes we want to do it ourselves, but we don't want to be burnt out, so we delegate the care to other people. In whatever you do, delegating the care to someone else or caring for your elderly ones yourself, you just have to make sure they are safe. That is the basics. The same way you would tell a child, don't go to the fire, it's harmful. Some of our elderly ones, they need us to be so close to make sure that they are safe. On this channel, we're going to guide you through, like I said before, how to take care of your elderly ones. And today, we are just going to talk about the basic things, the 5 basic things that you have to make sure that it's safe for your elderly ones to be okay if you're with them or when you delegate the care to someone else. And at the end of this channel, I'm going to add a link to the slide that I'm going through right now. You can access the slide, make a printout and keep it in your home just to stand as a constant reminder for you and your family. And today we're going to make sure that our elderly ones are safe. One of the safety checks we have to do to make sure that we prevent them from falls and injuries, catch health problems early before it escalates, support independence, build trust and peace of mind. I know sometimes you might want to stay away from the doctors, but at this point, before you buy any medication to give to your elderly ones, you have to make sure that those medications are prescribed. As we go on this slide, I'm going to tell you why you need to make sure that every medication that your elderly one is taking is prescribed. There is something called polypharmacy. This is when someone has more than one medication they are taking for multiple diseases. Some of them have hypertension, diabetes, name it, and they have different medications for all these things. You have to make sure that one doctor and pharmacy are included, or they are into the care of your elderly ones, because if you have multiple people taking care of them without referrals, there is no way to track the care that they are receiving. They might have hypertension medication, and then you have one, and then you go to another doctor, they prescribe another one. Those medications may not work well when mixed together. That is why you need to make sure that you keep in track everything that they're doing. Back to the safety at home. For them to be safe at home, you have to make sure that the floor is free of any clutter. Make sure there is good lighting at home. The bathroom has grab bars and the floors are dry. Make sure that they wear shoes that have non-slip soles. I'm going to put a picture in the slide so you know what it looks like. And their socks should not be slippery. They have socks that have a base that when they step, they don't easily fall when they wear those socks. And their medication, make sure that all the medications that they are taking at a time, there is a note for every medication they are taking. Make sure they are taking the correct dose. No missed medication. Do not double their medication. If they miss a dose, let it be. You can ask the doctor if they can continue from where they stopped, and then make sure that the medications are stored safely. Something that the elderly, some people do when they feel headache, they might go to their medication cabinet or where you keep the medicine and try to take them. But just to make sure they are safe, the same way you keep medicine away from little children, also keep their medicine away from them. Like I said before, there is something called polypharmacy. I'm going to just define it to you. Polypharmacy means taking many medicines at the same time, usually 5 or more. This often happens with older adults who have conditions like high blood pressure, diabetes and arthritis, because there is something called drug interactions. You do not want to take multiple medicine, or you do not want your elderly one to take multiple medicine that will cause a harmful adverse effect in their body. You don't want them to take medicine and then they are reacting. You don't know which one they are reacting, even though they are to be taken care of. Sometimes with medication, just make sure you keep note of every medication they are taking. Just make sure that whatever you give them, you are taking note, and make sure they are not taking a lot of medicine at the same time. You can do this with the help of your doctor or the pharmacy to make sure that the medications are well tracked. So when they have adverse reaction, when they have a reaction to the medicine, you know which one exactly is causing the reaction. Then it can be eliminated and then given something that can substitute for that one, just to make sure they're not lacking in taking their medications. and then we need to keep them comfortable. Sometimes the elderly ones, they try to mask their pain. They don't tell you what they feel, they don't tell you how they are feeling. It's left for us who are their caregivers to pinpoint if they're in pain. Sometimes they might not tell you verbally if they're in pain, but you can tell if they're in pain through their facial expression. If you have the means to check their vital signs at home, vital signs means their pulse, their blood pressure, their temperature, you can check. If the temperature is elevated, it means maybe they have pains of some sort. If their heart is racing or their blood pressure is high, maybe something is going on that they're not telling you. Check their skin for redness. If they have on their knees, on their elbows, and on their back, anywhere there is bony prominence, make sure you check on a daily basis to make sure if there is any bruise, because if they have bruises, for elderly ones who have hypertension, it might be difficult to treat some of those injuries. So make sure you check their skins. If there is any redness, if there is any sore anywhere, make sure that you take them to the doctor, or try in your own way to see that that thing is taken care of so it doesn't escalate. And make sure that their breathing is normal and there is no pain. They are alert when you want them to, when you call them, when they're not sleeping, make sure they are responding the way you want them to respond. Because when the elderly ones are drifting and they're not paying attention, sometimes infection might be going on in their body. That is why you have to, as their caregiver, make sure that you check these things daily. And for emergency, just make sure they have a phone to reach you. If you're not the one directly taking care of them, make sure their caregiver or themselves have a direct phone to get to you when they are in need, when they need you, or when there is an emergency. And make sure that close to your home there is a hospital or someone who can get them to the hospital as quickly as possible. Emergency numbers, make sure that you have some type of way, call the emergency for them, and make sure that every medical information they need is readily handy. Sometimes you might want to print out their medical records on your own and have them handy when you're taking them to the hospital. I know that the doctors do their best to take care of our elderly ones, but it's also on us as their caregivers to make sure that we have every information that they need, the doctors need. We have to be on top of the game so that there won't be any errors or mistakes, or sometimes it just that the human nature, so there are no mistakes and then there is harm in the way. Just make sure you're readily available. If you have to delegate care of your loved ones to someone else, try your best. Give them a phone to call you when you're not available. Make sure they get the help they need. Taking care of your loved ones as a healthcare worker who's taking care of them, as a caregiver at home, or someone who has been delegated this care, you make a difference, and you have to be emotionally stable to take care of your loved ones. And so in the series, as we go on, we're going to talk about the emotional balance for caregivers, be it a doctor, be it a nurse, or be it a family member who is taking care of an elderly person. Thank you for watching our channel today. You can like, subscribe, and share with your loved ones. Thank you, and have a good day.